Diltiazem, also known as Tiazac, is a medication used to treat high blood pressure and prevent chest pain. It helps lower high blood pressure to prevent strokes, heart attacks, and kidney problems. Taking Tiazac regularly can also reduce the number and severity of chest pain episodes. It may even improve your ability to exercise. Tiazac is a calcium channel blocker, which means it relaxes blood vessels in the body and heart, allowing blood to flow more easily. It also lowers your heart rate, which helps the heart work less hard and lowers blood pressure. The typical daily dosage of Tiazac varies depending on your condition and medical history, so it's important to consult with your doctor to determine the best time to take it. When taking Tiazac, it's important to follow your doctor's instructions. Usually, you'll take this medication by mouth once daily, either with or without food. Swallow the capsules whole and avoid crushing or chewing them. If you have trouble swallowing the capsule, you can open it and sprinkle the contents onto a spoonful of soft, cool applesauce, then swallow the mixture right away. Make sure to rinse your mouth and swallow the rinse liquid to ensure you've taken all of the medicine. Your doctor may adjust your dose over time, so be sure to follow their instructions carefully. The dosage will depend on your medical condition, how you respond to the treatment, and any other medications you may be taking. It's important to take this medication regularly to get the most benefit from it, and to help you remember, try to take it at the same time each day. Even if you start feeling better, continue taking Tiazac as prescribed. For high blood pressure, it may take 2 to 4 weeks before you feel the full benefit of this medication. If you're taking Tiazac for angina, remember that it's meant to be taken regularly to prevent angina attacks, not to treat them when they occur. If you experience an angina attack, use other medications as directed by your doctor. Be sure to inform your doctor if your condition worsens, such as an increase in chest pain or blood pressure readings. Remember to tell your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Some common side effects of Tiazac include dizziness, lightheadedness, weakness, nausea, flushing, constipation, and headache. If any of these effects persist or worsen, notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, it's important to get up slowly when moving from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience serious side effects such as persistent nausea or vomiting, fainting, new or worsening symptoms of heart failure, irregular heartbeat, changes in mental/mood, severe abdominal pain, dark urine, or yellowing of the eyes/skin. While a severe allergic reaction to this medication is rare, seek medical help right away if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Tiazac, it's important to talk to your doctor or pharmacist if you have any allergies or if you are taking any other medications. This is because Tiazac may contain inactive ingredients that could cause allergic reactions or other issues. You should also inform your doctor or pharmacist about your medical history, especially if you have certain types of heart rhythm problems, liver disease, kidney disease, or heart failure. Tiazac may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also important. Before having any surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Tiazac, especially experiencing dizziness, constipation, or swelling in the ankles/feet. If you are pregnant, Tiazac should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Tiazac can pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. When taking Tiazac, it's important to be aware of potential drug interactions. This medication may interact with other drugs such as digoxin and fingolimod. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. They can help determine if there are any potential interactions and adjust your medication as needed. It's also important to note that Tiazac can affect the removal of other medications from your body, which may impact how they work. Examples of affected drugs include aprepitant/fosaprepitant, asunaprevir, and certain benzodiazepines. It's important to discuss all the medications you are taking with your doctor to ensure they are working effectively. Additionally, some products may have ingredients that could raise your heart rate or blood pressure. It's important to inform your pharmacist of all the products you are using, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen, and ask how to use them safely while taking Tiazac. As always, it's important to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. If you suspect an overdose and the person is experiencing severe symptoms like passing out or breathing difficulties, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share Tiazac with others. Talk to your doctor about lifestyle changes that can help the medication work better, such as stress reduction, exercise, and dietary changes. Your doctor may want to do lab and/or medical tests while you are taking Tiazac, such as kidney/liver function, pulse, blood pressure, and EKG. Make sure to keep all medical and lab appointments and consult your doctor for more details. There are different brands and types of Tiazac available, and they may not all have the same effects. Don't change brands or types without consulting your doctor or pharmacist. It's important to have your blood pressure and pulse checked regularly while taking Tiazac. Learn how to check your own blood pressure and pulse at home, and share the results with your doctor. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take a double dose to make up for the missed one. Make sure to store Tiazac at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.